PGD, or preimplantation genetic diagnosis, is when we're diagnosing for genetic diseases. Sometimes couples come to our office knowing that they carry a mutation in their genes. This may increase the odds for a child with special needs or even a child that might not survive childhood. They choose to diagnose their embryos. The embryo might be a carrier of the disease, might be an affected child with the disease, or a normal embryo. They choose to go through IVF to examine their embryos so they are not faced with a child with a devastating illness. PGS is a little different, but much more commonly used in the IVF laboratory. PGS is preimplantation genetic screening. This is when we count chromosomes. Many embryo transfers do not lead to pregnancies. We have learned that many times that embryos fail in the IVF lab, as well as many miscarriages, or even the etiology of infertility, is because the embryos are not normal. Nature does not allow embryos that are chromosomally abnormal to grow. If we do PGS, we are counting the chromosomes in the embryology lab. We should have 46XX or 46XY chromosomes in a girl or a boy embryo. That's what we want to transfer. If we can diagnose 46XX or 46XY before transfer, there's an 80% implantation rate. The likelihood that embryo takes, whether you're 25, 35, or 45, is extremely high. Lots of couples are now choosing to genetically test their embryos when they're made in the IVF lab. Some women will not have embryos that are normal. They will not get an embryo transfer. But those women who have normal embryos at any age will have a very high chance that that embryo will stick and lead to a live birth.